some myths, I'm talking about misconception that we do have concerning our health. So I would want you to verify these misconceptions. Like when you're treating malaria, for example, you should treat typhoid. So malaria and typhoid should always go together. So can you help us verify, mention these myths and also help us verify these myths?
Let me start. There are a lot of misconceptions, a lot of myths about health. Like let me begin with what you said. Say if you have malaria, you must have typhoid too, so you have to treat both of them. Um, Unfortunately, it is not true. The one thing is that the body has a similar or a peculiar way of irritability. I mean, stimulus, responding to stimulus. So, for instance, if you have malaria, there's every tendency that you have fever. If you have typhoid or you have infection, you can also have fever too. But these fever, they are being detected according to their episodes. You understand? When did you start feeling this fever? Somebody that can have tuberculosis can also have night fever and sweating. Do you understand? But people would think, it's malaria alone. You understand? But now, like I said, you can have malaria and you still don't have typhoid. That is why it is always advisable when you have symptoms, see a doctor. A doctor will now do what? Clerk you. In medicine, so what we call clerking, because that's a you see the doctor for consultation. Doctor will use his medical prowess and say, okay, he will write down, go and do these tests. It is after the lab tests we will now know what you have. A lot of patients that I have that come, they just say, I want to treat malaria and typhoid. They don't actually have typhoid most of the times. They just have only malaria. I tell them you only have malaria. Now imagine going to just go and take antibiotics without doing tests. You stand a chance of having what they call multi-drug resistance. Your body becomes resistant to antibiotics, which is bad. Because the time you will need those antibiotics, they won't be effective for you. They won't be effective in your body. So that is why it's always advisable. Go to the hospital, see the doctor, and do a checkup, a lab test, run a lab test or series of lab tests. Then you can now do the same. You can now then say, okay, I want to treat this disease. At least that goes with precision. You understand? It goes with a lot of precision and accuracy. You understand? Because a lot of diseases can stir up some kind of disease. For instance, like HIV. HIV is just a disease that can bring up a lot of things. It's not because of the disease has its own symptoms. It doesn't have its own symptoms like malaria. What it does is that, like as the name implies, human immunodeficiency virus. What it does is it is an immunodepressant. It will suppress your immune system. There are things that your body is actually fighting as you are like this. A lot of things you're supposed to, if they remove those white blood cell fighters or those, WBC, those antibodies, you are gone. They are fighting it, but when somebody has this HIV virus, you find out that the virus starts depleting these fighters. That's when now the person now becomes exposed. Little cough is now leading to tuberculosis. Fever, in fact, organ failures and the rest of it. So a lot of these myths are very, very, very false. Also, I also have the one that like I don't know. Somebody said when they finish having sex now, they just go and take one antibiotics. Bah, it will flush it. That's wrong. It's actually wrong. Like I said, you stand the chance of having multi-drug resistance. You don't know the person you have to have sex with. The person, okay, let's say for instance, the person has a bacterial infection. You take an antibiotics that doesn't even match it. Though there are some antibiotics that are broad spectrum. In medicine, there's what they call broad spectrum. They can treat, there's antibiotics that can treat gram positive and gram negative infection, bacterial infection, precisely. But still, you may be resistant to that particular antibiotics. And it will be another antibiotics in that family that could do it, or in another drug family that could do it for you. But taking it doesn't, you are just, number one, you're stressing your kidneys, because most of these antibiotics are harmful to the kidneys, especially for like one family of aminoglycosides. They are very harmful to the kidneys, so they are not friendly to the kidneys. So it's better you see a doctor. And also, you don't know, antibiotics cannot cure viral diseases. You don't know if the person has a viral disease like HIV. You just rush, take antibiotics, it will not cure it. it will not cure it. And also, there's a particular this thing that they say. One of the myths that somebody was like, blood transfusion is spiritual. It's not. It's not. Once you take person's blood, if they transfuse, you have spiritual something. That is wrong. We know blood is life. We know that you use blood to do a lot of diabolical things, but actually, this is not true in the sense of medical stuff. In the sense that because somebody transfused blood to you, you will now have the person's spirituality. No, we screen if a blood for a blood to be transfused to somebody, blood will be screened medically. Blood will undergo blood grouping, cross matching, and then serologies of tests. You understand? To HIV, hepatitis B, hepatitis C, syphilis, for the person to know that this person is actually fit to give you this blood. So also, people have a lot of things that for you to feel sick, you must have symptoms. It's not totally true. In fact, symptoms, you don't know what your body is fighting. When your body has starts showing a lot of symptoms, it means that the fight has become intense. And now the body's trying to, your body's trying to. That's why if somebody is having a, let's say, for instance, infection, if they do what they call white blood cell count for the person, you find that the white blood cells are very numerous. Why? Because there's a deploy of what? These soldiers, these antibodies to fight that infection in your body. So because you're feeling okay and all right, doesn't mean that I mean, because you're asymptomatic, doesn't mean that you're okay or you're people with. I've seen somebody. I mean, a series of patients that are with HIV. They look very sound. You ask them, "Have you started noticing?" They say, "No, I've not started." But like I said, HIV is very, very deadly. Viral diseases are very, very deadly. What the virus does is that as it enters into your cell, its first motive is to take charge. So it starts what? Deploy its strands around. That's why when the thing becomes too much, that's why the person start breaking out. Because by then it has gone far. You understand? So it is very, 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 very that is it's something that people need to take note of. Check yourself. Even if you're feeling good, you can be looking good and sound, but you're having high blood pressure. Seriously, when you go and check yourself, you say, your blood pressure, how come you're walking? How come? I've seen somebody, I've checked a patient that high blood pressure, blood pressure was up to like 170, 180 over 100. Patient was like, I'm not feeling anything. But that alone, within, let's say, few minutes or few days, you just hear the person just slumped and died. Then people will be like, now from village, they send them. No. It's just that people are not really, 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 we really don't check ourselves. We like, until I say, don't you break down, say, make I go check myself now. No. Check yourself every time, especially looking at the activities you do. Say, once in a while, check yourself. Do blood test once in 3 months or 2 months. Do blood test, HIV. Because you're not sleeping around or you trust your partner doesn't mean you shouldn't check yourself. Check yourself for HIV. Check yourself for hepatitis B. Hepatitis B is very, very is a silent killer. It's deadlier than HIV. Hepatitis B can be with you for years. It can just be there. It's damaging your liver. Like that, like that, like that, like that. So it's advisable, and it's a disease that is not just through sexual intercourse. It can be gotten from. It's a very strong viral disease. It can be here for like 3 days, 4 days. Somebody come and touch it now, it can enter into your body. So it's something that people should be mindful of. You understand? So, and also another myth is that people say, when you cannot stay close to somebody that has HIV, if you touch the person, you will contact it. That is not true. You can stay with somebody that has HIV. Yes, you can stay with somebody that has HIV. As long as HIV mode of transmission is blood transfusion, sexual intercourse, cuts of infected substances. Let's say maybe through needle pricking, razor blades, or any sharp object. Those are the things. You understand? So talking with somebody, hugging with somebody that has HIV doesn't mean you will contact it. It is not like that. HIV is not actually like that. HIV is just based on blood fluid basically. So it's not from I'm talking to this person. It's not like tuberculosis. It's not airborne. You understand? It's not like that. Except the person infected with the disease has tuberculosis, then you have to abstain yourself. But aside that, because the person has HIV, you can still interact with the person normally. Give them this. Then also another myth is that People for cancer, people say, cancer has no cure. No, cancer has a cure as far as it is detected early. Not just breast cancer alone. One of the top leading cancer type of cancer is cervical cancer. This one affects the cervix in the women, the epithelial surface of the women. So what happens is that in that case, that's why we advise women go and do test, run test, and also take HPV vaccine. As far as you've started having sex, you stand a high chance of having cervical cancer for a woman. It's very, 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 very important. It's very, very important. So you go and get vaccinated. First of all, check yourself before you get vaccinated. Then also, once cancer is early detected, it can be cured. There are a lot of people that are cancer free. For instance, the famous artist, Banky W. He has done cancer. He has fought cancer, I think twice or once, if I'm not mistaken. Yes. That's why you can see that he's not having that much of hair. It's always on this thing. So you can beat cancer. So far as it is early detected, it hasn't spread then. So you can actually fight cancer. Then, lastly, one of the myths that people also say that um, blood, people always take religious things with this thing. Okay, for in the area of herbs, people will be like, herbs do everything. No, I don't advise my patients to be on herbs. You know why? Now, if we look at drugs, these conventional drugs we have, they've been studied over time. These substances have been studied over time. I mean, currently as we are talking, researches are ongoing. Governments of the United States, UK, they are putting in money for scientists to say, work on these diseases, work on these substances. What can this substance cure? What can we use this substance to manage? What type of disease that we can use this substance to treat? So it's actually ongoing. But in terms of herbs, there's a problem because a lot of these things we get cure from trial and error and also by accidents too. We just get cured by accident. Say, take this, the thing work. But sometimes something can work for you, it cannot work for me. And also, herbs are not actually refined. They are crude in nature. That's why they are not good to be consumed like that. They are very, very crude in nature. So they can be affecting, damaging your liver and your kidney while you're saying you are treating you. And also, like I said, they are not really, really studied. So that's why it is not advisable to start taking them. Like,
Thank you so much, Mr. Job. This was really an enlightening section, and I know that you, the viewer, you've learned a lot of things from this video. So thank you for joining us on Lifestyle and Your Health podcasts. See you in our next video.